Alright, so for the next type of virus that we'll be looking at the HTLV, and the HTLV is actually what is fully known as what the human T lymphotropic virus. Okay, so this human T lymphotropic virus is actually a virus that can be able to cause a type of disease known as what adult T cell leukemia. So instead of discussing the two concepts separately, since this virus can actually cause this disease, I just combined the whole stuff together. Alright. So looking at this, we'll first of all look at the virus first, looking at the structure here. Then next we'll actually look at the adult T cell leukemia. Now this adult T cell leukemia had so many pictures online, but the pictures were actually scary. And if I put those scary pictures here, YouTube will actually ban it for, what do they call it? Shocking content. Okay, so I had to actually keep it away. But looking at this organism now, so that the human T lymphotropic virus and the adult T cell leukemia are closely linked. All right. So that the human T lymphotropic virus was the first human retrovirus that was discovered to be oncogenic. All right. So it had the potential of causing a cancer in you, and that was discovered in 1977. All right. So for transmission, we say that human T lymphotropic virus is primarily transmitted through infected body fluids, including blood, breast milk, semen. Alright. So risk factors for having it include you having unprotected sex, right? Or injecting drug use, okay, transplantation of tissues, blood and blood products, what do they call it? Transfusion. Okay. So for prevalence, that an estimate about 5 to 10 million people globally actually have this human T lymphotropic virus, although the actual number might be higher. Okay, so it's not really known because there's an unreliable or there's lack of reliable data on this. Okay, so associated conditions. So apart from causing adult T cell leukemia, this human T lymphotropic virus can cause what a progressive nervous system condition, which is known as what a human T lymphotropic virus associated myelopathy or tropical spastic paraparesis. Okay, so now coming to this disease that this human T lymphotropic virus likely will cause, that's the adult T cell leukemia. So that is actually a rare, but when it occurs, it's actually what aggressive. So it's a type of cancer that usually affects the T cells, which are a type of what white blood cells. Okay, so causes, we say that what this adult T cell leukemia is caused by what human T lymphotropic virus infection, just like we said. The virus integrates into the host genome, and this will actually lead to development of T cells that are cancerous. Okay, so for symptoms, you'll be tired, that's fatigue. Fatigue is more of like you are tired, like let me say you rest, you're still tired. Alright, so there'll be skin lesions, there'll be swollen lymph nodes, there'll be bone pain, there'll be too much calcium in the body. So this adult T cell leukemia is what categorized into four subtypes. Could be acute, starting all of a sudden, could be chronic, could be smoldering, could be lymphoma type. Okay, so the acute and lymphoma subtypes are particularly aggressive and have a poorer prognosis. Thus, you have poorer chance of recovering if you have it. So treatment options include chemotherapy, antiviral therapy, stem cell transplantation, and the choice of treatment actually depends on the subtype and the patient's overall health. Okay, so that's it.